If you're a swimmer or a triathlete, odds are you've dealt with shoulder pain in the past. Today we're going to show you how we treat shoulder pain on our triathletes and our swimmers here in this office, specifically from a soft tissue perspective. We're going to showcase a couple active release techniques, moves, ART moves. If you're a triathlete, your odds are you're familiar with ART. We'll dive into a few of the rotator cuff ART moves here for you today. All right, first muscle we're going to attack is a muscle called Supraspinatus. This is a rotator cuff muscle. It's probably the most commonly sore and tight muscle that we see in our patient base, especially in people with overhead motions, just because that muscle is responsible for this abduction, this elevation of the shoulder here, okay? And then when in swimming, there's a lot of that, right? So we wanna make sure that there's no tightness or overuse type symptoms in that musculature. And this is important because this is the muscle responsible for shoulder impingement. So if you have a tight a supraspinatus that travels directly under that AC joint, we can really cause that impingement type syndrome to start to develop. So we want to make sure we nip that in the bud before it becomes an issue. So we start the patient in a contracted state. Good, hold that right there. Good. And you're just going to go ahead and reach back behind your back to your left back pocket. Awesome. So you can see where my thumb is contacting the muscle. We're starting here in a contracted state, and we're getting a nice stretch through that muscle. All right, so this next muscle is called Infraspinatus. This is the muscle that's responsible for external rotation, so bringing the arm out in that overhead position in a swimming posture. This is a very important muscle and that we see very tight very frequently. So we're gonna bring that out in that externally rotated position, and we're gonna straighten the arm and then turn the thumb down. There's actually two muscles here, infraspinatus and teres minor, both rotator cuff muscles. So we'll hit both of them simultaneously, and you can see I'm just putting tension into that muscle in a contracted state and having the patient lengthen that muscle. Very simple technique, very effective, not only for swimmers or triathletes, but just about anybody who works at a desk and tends to develop that kind of knot right in that shoulder right there. This is a great technique for them. All right, the last muscle we're going to work here is a muscle called Subscapularis. This is probably the most underappreciated muscle in the rotator cuff, but arguably the most important to treat because of the effect it has on the rest of the system. It's a very tough muscle to get to because it lies actually on the front side of the scapula. So we actually have to kind of go in through the armpit. So this isn't for the ticklish here, but we're gonna get that muscle in a contracted state, so internally rotated. I'm gonna get my thumb down into her kind of armpit on the front border of that scapula, and I'm gonna stretch out like this. Good. This is a very intense stretch. This alleviates a lot of symptoms related to swimming just because of the internal rotation type of posture and motions that are involved in that specific motion pattern. And it's very palliative for patients who are dealing with shoulder impingement and things like that. So if you have trouble reaching behind your back to like tuck your shirt in, this might be the move that's right for you.